trauma healing is kind of a shortcut to greater enlightenment and to deeper compassion and to non-attachment. Because if we let go of the pain and the hurt and the trauma, then we come back to our true compassionate selves naturally. It's just so beautiful to see.
Why are so many medical doctors walking away from the healthcare system? Actually, maybe we need to call that something else. We don't have a healthcare system. We have a sick care system. And it's not just in the US either. Around the world, there are problems with healthcare that are causing many doctors to make different choices on how they want to be in practice, support their patients, support their clients, and show up for those they're serving and also themselves to help them heal and to also live well. Maybe this has been your story. And don't get me wrong, there are so many wonderful doctors and nurses and practitioners in the healthcare system that are practicing compassionate care, seeking to look for the root cause, to not just look at the symptom, and to genuinely look by using holistic approaches that treat the whole body, right? That holistic means whole body. And I work with many of them as a holistic practitioner myself, and I'm grateful for the work they do. This is about the system they work in, not the person, the one that is not showing up for the caregiver. That's what we're seeing a lot. And the word that I want to focus on right there is care, compassionate care. Well, Dr. Robin Youngson, you are one of those doctors with over 30 years as an anesthesiologist, working with the World Health Organization, being an advisor in New Zealand with the government on patient safety and healthcare quality and compassionate care. And you're also a fellow Havening practitioner and trainer, which is the work you have gone into. And my goodness, what a joy it is to have you here, because you're the kind of doctor that we need more of in this world. So thank you for being here. It's so good to see you, Robin.
Thank you, Hilary. I'm delighted to be invited onto your program. Thank you so much.
Absolutely. I have been wanting to talk to you for quite some time. We obviously don't get to connect too much because we're on opposite sides of the world, but we do get to connect through the Havening world, being that we're both practitioners and trainers of the field. You've been a trainer quite some time as well. But you took a pretty bold step, and I know we're going to talk about your latest book, which is The Science of Miracles, which I can't put down. In fact, I keep reading chapters over and over because it's such a personal story. But I think for those who are tuning in, what I really want to touch on first is, how does somebody with an entire career as a doctor, and someone who actually started as an engineer and got into medicine, how do you make a choice to walk away from your practice and possibly your patients and the system that kept you employed for so long? And you only made this choice in 2020. So we'd love to know that story.
Yeah, I'd have to say that was an absolutely terrifying decision to make. Unlike most of my peers, anesthesiologists who, earned a lot of money and have a big flash house, and my wife and I have devoted so much of our lives to trying to improve the system, to campaign around the world. I actually spent all of our money doing that work. I'll be 69 in a couple of weeks. We don't have any savings. I'm still paying a mortgage. We're not financially secure. And to walk away from a job as an anesthesiologist with all that financial security and status and power and reputation, and to step into a kind of alternative healthcare field, which my medical colleagues would regard as, woo-woo or strange or even fraudulent, was just an extraordinarily difficult decision to make. And I'm grateful to my wife, Meredith, for supporting me in that. But basically, I've spent my entire life trying to make healthcare better and provide compassionate care to the people we serve. And I just saw that there were much better ways of doing that outside of the system, and in particular, having learned about Havening techniques and seeing the miracles that unfold every day in our clinics. And then COVID hit, and in actual fact, the contract medical work I was doing disappeared overnight, so I had zero income. So I had no choice but to make a success of my own clinic. And that was 4.5 years ago.
Amazing when you look back on it, how you've grown over the years. And you're really one of those folks that pop up if you're putting in havening on YouTube, there's a number of us that pop up, but I have to say a number of folks will come to me if they've never heard of havening. They're like, there was some gentleman that popped up and he was doing stuff about havening. I'm like, oh, that's probably Robin. Because you really have brought attention to havening and the world of havening and just how this is a neuroscience-based modality that can help people rapidly heal from anxiety, depression, PTSD, phobias, relationship difficulties, sleep, chronic pain. And you saw that as a doctor, and here you are flipping on the other side and seeing it's not so much about what the doctor does, but what we can do for ourselves and put the healing in our own hands.
Yeah. But I have to admit that I was deeply skeptical about havening. So how I came across it was that my wife Meredith and I had made many trips to Louisville in Kentucky, which you might not know is under the International Charter for Compassion. Louisville is the model compassionate city in the USA, led by a very inspirational mayor. We were invited into the city to try and bring more compassion into healthcare across very many different organizations across an entire city. And that was the home of Harry Pickens, who's a renowned havening trainer, an extraordinary man, and world famous jazz musician, and so he became a very dear friend. And for about 2 years, he was trying to persuade me to take an interest in havening. And I said, "What's that?" He said, "Well, you can have the worst trauma in the world, and you just stroke your arms and your face and your hands for 15 minutes, and the trauma can be erased." And I'd never heard anything so ridiculous. And even though he's a very esteemed friend and colleague, I completely ignored his entreaties for several years. And then he wrote a whole book about it called 15 Minutes to Freedom. And I don't know if you've interviewed Harry. He would be a great subject.
He's on the list.
To my shame, I didn't even buy his book, even though he's a great friend. But my wife, Meredith, had a copy in her room. And every time I went into the room, I'd see his book on the shelf. It was like a reproach to me. And so one day I said, "Hey, darling, can I borrow your book?" And I sat down and read it, and I got intrigued because he interviewed Dr. Ronald Ruden, the developer of havening, and shared something about the science, which intrigued me, and then a lot of stories from practitioners and from clients. And I thought, hey, maybe there's something to this. So I did what we all do. I sat down on my computer and did a Google search for havening. And I came across a video of Dr. Ruden havening someone for a severe phobia of bridges. So this poor woman, while driving across a very high bridge over a waterway in a tremendous rainstorm, the rain fell so heavily she couldn't see the lines on the road, couldn't see the other vehicles, couldn't see the barriers, became disorientated. She had kids in the back. She thought she was going to die. She had a panic attack. And then over a number of years, the phobia got worse and worse and spread to other bridges until eventually she couldn't drive across any bridge at all, even a really small bridge. And her life had kind of shrunk down. And she chose to do the havening touch to herself, what we call self-havening, and Dr. Ruden took her through the simplest protocol, which is to erase a traumatic memory. And in 15 minutes, and that's how long the video is, her trauma and her fear was completely gone, and she sat there completely astounded. And then he said, "Well, should we go and check it out?" And she said, "What do you mean?" And he said, "Well, we're not far from that bridge. Would you want to get in the car and check it out?" And she kind of looked at him aghast, but eventually agreed. So she drove across the bridge with no reaction at all. And I watched this video and sat on my computer for quite some time, shaking my head in disbelief that this terrible fear had been erased in 15 minutes. And then I began thinking about some of the very traumatic events I've experienced as a doctor, like a young mother bleeding to death in front of me, despite my best efforts. Then had this crazy thought, what if I try it? So I rewound the video and copied the entire process. I copied the touch and I copied the distractions. At the end of 15 minutes, I could not connect into my traumatic event at all. It was erased in my mind. I could remember objectively the facts of it. And I just sat there again, completely astounded, and thought, no, I've got to train in this. So I discovered there's a training course in Melbourne 3 weeks later in Australia. And Louise Carmi and Donna Ryan were flying from the UK and the USA to run that course. And on the first day of the course, I volunteered to be a subject for havening in front of the class, and had my profound fear of abandonment that I'd had for 52 years was erased in 15 minutes as a demonstration in front of the class. And I mean, that was really life-changing. And so that was 2018. So I've never looked back, really.
I think a lot of us have a very similar story. That's how Havening came into my life as well. As I was not a doctor for 30 years. I did not have a background, and I was coming from a completely different field in journalism. And yet that one day, that first day of the workshop on stage with Dr. Ron Ruden, I volunteered as well. And I never looked back. I remember saying, I've got to put this into my practice, because there is a skepticism, and
Yeah,
I think that is what's so beautiful about more people in the medical field that are seeing its value, whether they are still in the actual medical system and the healthcare system. Some of the folks I've been recently training are doctors, are nurses, are first responders, and at least are taking a chance to see this is something that could help put the tools in somebody else's hands to
yeah. Hmm.
to help themselves. But that's just part of the story. And thank you so much for sharing that. I love hearing that story too. I've heard the bridge story from Ron before. And yes, shout out to Harry Pickens as well. He's wonderful. We have so many wonderful people in this community, including yourself. But your work getting to this point, I want to go back a little bit, because as
Sure.
someone who's been in the system for so long, and you even mentioned having your own traumas as a child, and you mentioned it in your book, which is The Science of Miracles. This is your latest book, which is One Doctor's Journey to Find Hope and Healing Beyond the Broken Medical System. My friends, please put this in your library. It is a beautiful read. It is such a personal read, Robin, that to learn about you before your time as a doctor, but also during your time, and then making that decision to walk away,
Hmm.
really, really builds the story, which is different from your first book, which was Time to Care, which sparked this international movement about why compassionate care is so important. So, as somebody who's been in this field for so long and then moved away from it, like you just shared, where was it where it clicked in you to say, I need to write my personal story? Like, I need to put it out there. I need to share it this way.
Yeah. So that's a bit of it's been a long journey. I've been working on that book for 3.5 years, and I've actually written the whole book 3 times. and I really struggled to know what kind of a book, because my previous book, Time to Care, was written as a non-fiction book, with 200 scientific references and lots of arguments and so on. It had a lot of personal stories as well to really connect to the heart of people. But we learned on our international campaigning work on compassionate healthcare that, if you try to persuade people, you just create resistance, because they're deeply embodied in their own worldview and their beliefs and ways of working. And, if you suggest something different, it's in some ways threatening to them, or they have to give up something, or, learn something new. And eventually we evolved ways of not preaching to people, but putting people in a circle and getting them to share their stories of compassionate connection and human connection and healing. And they would learn from those stories and hear the stories in the group and remind themselves of all these precious gifts of care and compassion and empathy that they have, and what an amazing life-saving difference it made. So we found more subtle ways of influencing people for them to find it within themselves. So I wrote a kind of non-fiction book, which is a kind of mismatch, partly autobiographical, partly non-fiction. I tried to make arguments, and then send it to a professional editor and said, look, I want you to review the book and tell me what you think, and spent a fair amount of money on that. And she was very helpful, and she said, well, it's just not working in this mismatch, but if you wrote a medical memoir, it could be effective. There's really not a single argument in the whole book. I don't try to persuade anyone to do anything. But if I share my story, if I can get people on board with my passion, my story, and my hurts and my wounds and my traumas and, my struggles against the system, and eventually finding the light, then they might come along with me on that story. So that was the third version. And then it ended up far too long, up like 153,000 words, just far too long for a book. There were so many wonderful stories. And in 1 week, I cut 40,000 words out, and it made me nearly physically sick. I mean, it was such a painful process to throw out so many wonderful stories, but the book is better for it. So that's how we ended up with and then I decided to dramatize it, write it like a thriller, write it, as a dramatized nonfiction, and really get people into the stories. So that's how it ended up. And then I found a professional editor, Beth Derry in the UK, who's done a wonderful job, and took it on as a passion project and helped me out.
somebody that saw the gift that you were giving.
Yeah, thank you.
Yeah. You mentioned that it was painful to cut a lot of those stories. And what that kind of reminds me of is when we're working with our clients, and this is something that comes up, and you want to reinforce to them, because sometimes they don't want to get rid of their trauma. They don't want to, they feel like they're getting rid of the story or what built up
Yeah.
that story, you
Yeah.
know? And it's a reminder to them. It's like, this is part of a chapter in your book, but it doesn't mean you can rewrite the narrative, but it doesn't take away this, because sometimes people are angry, or they're like, no. If I forget it, it means it didn't, I'm taking blame away from whoever did whatever they did, or the upset. And it's quite the contrary. So when you mentioned that you took pages out of this final copy, what was that feeling that you were truly feeling?
Yeah. I mean, I think you're right. I'm not going to answer that question directly because I want to come back to your point. And that is, I mean, the work that we do in trauma is really all about stories. And here I'm sitting in my clinic room, and you can't see a lot of it, but it's actually full of curious objects and historical things, and gifts to me from my, and all sorts of things. And I work a lot with kids as well. And I said, come in, pick anything up, play with anything, because we're really working with stories. And the beautiful thing about this work is that I'm very careful to explain to clients that you're not going to lose, if you've lost a loved one in a very traumatic way, you're not going to lose the memory of your loved one. In fact, at the moment, all you can remember is the terrible traumatic last hours or days, and you can't even connect to who that beautiful person was. And if we take the trauma away, then all of the lovely stories of that loved one are going to come forward, and you're going to be able to grieve in a healthy way. And when we've, every difficult life experience, every trauma carries gifts within it. And I often say that the people who become the very best practitioners are those who've had their own severe trauma and gone through a path of healing. And then they bring the gifts of empathy and compassion and non-judgment and understanding and faith and healing. And they bring those gifts forwards in service of others. And so when we let go of the trauma, we actually liberate our deeper gifts. And we come to a place of compassion naturally. Forgiveness is not required, because people just come to a place of ease and healing and compassion. And then they see that, the perpetrator was themselves acting out of their own trauma. And it's, it's really, one of my clients was a Buddhist monk. I was a bit surprised because I thought, you spent 20 years meditating on non-attachment and letting go of anger and, hurt. And why are you coming to my clinic? And it's just a human being like everyone else. But, in some ways, trauma healing is kind of a shortcut to greater enlightenment and to deeper compassion and to non-attachment. Because if we let go of the pain and the hurt and the trauma, then we come back to our true compassionate selves naturally. It's just so beautiful to see.
I love how you put that. It's so true. And in this day and age, the word trauma is such a buzzword. And there are a lot of words out there that have become buzzwords on the internet. And it's holding space for those, because you don't want to lessen what they're feeling or their story. And you're right, it's the story before it's anything. But you can rewrite that story so that this next chapter can be the gifts, the lessons, and the learning. Right. And building that resiliency. We talk about that a lot in Havening as well, as building the resiliency. But for yourself, when you had to make a choice to remove thousands of words and pages, what you said it was very painful. Why was that? Because
for so many years we've been dealing in the most extraordinary stories of human connection and compassion and healing. And I mean, some of those stories would move anyone to tears. I mean, they're just the most precious, profound stories that have been kind of gifted to us. And some of the stories are just hysterically funny, and just like, if you were reading a novel, it would just be so engaging and funny or exciting. And so I just had to throw away. I mean, there's probably another whole book worth.
That's what I was going to say. I'm like, what about a second book?
Yes.
Because those stories, I imagine, are healing for you too. It's therapeutic for you to write it down.
Yeah. I actually cried a lot writing my book because as a result of my childhood trauma and the way I grew up, and then entering into medicine, which in medical training is profoundly dehumanizing and brutalizing. And I speak about some of those things in my book. And really, I became, a very highly trained anesthesiologist and intensive care doctor in our biggest trauma hospital, doing all the glamour specialties of neurosurgery and trauma and transplant and everything else. Really at the peak of my career, but disconnected from my feelings. And I was always kind as a doctor, and I always was, maintained some compassion. One of the stories in the book is about our 18-year-old daughter, Chloe, when she broke her neck and her back and ended up 3 months in our biggest trauma hospital. And the quality of clinical care was pretty good, but how they treated her as a human being was just so beyond belief, the neglect of her basic human needs. Looking back on those times, it was a familiar environment in a hospital in which I'd worked. So I kind of retained, in a sense, my clinical detachment. And even though the events that I was seeing were distressing, I was kind of a bit detached or dissociated from it. But when I wrote the story again, 20 years on, I just sobbed, because as a result of doing this work, of getting into the world of healing and havening and trauma, I've actually healed so much of my own wounds and come back to my full humanity and, connected to my feelings. And yeah, there were a number of times I'd write a story and I'd write it in such a powerful way. And I was able to experience that event, with everything, with every part of my being, and to sob and to cry. And it was cathartic and healing.
Yeah.
And it makes the story so, and, being a trauma therapist gives us the language, right? Of feelings and emotions. And it's enabled me to write more powerfully. So it's been healing.
Well, I'm glad. I'm so happy that's been your experience. And I couldn't agree with you more that so much of the work that we do comes from our own healings involved in that. It makes you more empathetic and compassionate. We're coming from that space already.
Yeah.
So that's definitely something I think about a lot. And just showing up for people, it's not just sitting across from somebody anymore, like tell me your feelings and writing down and being judged like some therapist versus patient kind of thing. It's a relationship you're building. It's a trust. There's a vulnerability on both sides.
And it's, I've come to realize that it's pretty much the complete 180-degree opposite of medical practice in terms of the power relationship, and in terms about our, assumptions about what is making a patient or a client better. Because in the medical world, we pretty much reduce a human being to a complex chemical machine. The entire basis of evidence-based medical practice is a placebo-controlled, randomized controlled trial that removes any influence of human consciousness from the basis of medical science and medical practice and medical treatment. So that means that, when you go and see your GP, he's not going to listen to your stories or experiences or emotions or your feelings or your beliefs. He's going to measure your blood pressure and your cholesterol and put you on a pill, right?
Yeah.
In a 15-minute appointment. So the work I do now is the complete opposite, because as a trauma therapist, I'm not doing any healing to anyone at all. As we know, Dr. Ruden has given us a very sophisticated scientific theory around the mechanisms by which the brain can heal itself. And what we're doing is creating the conditions for that healing to occur within the client. So we're facilitating a natural process. And the power relationship has to be swapped 180 degrees, because you have to be led by the client's desires and feelings and wishes, and you're in service to the client's story, as opposed and facilitating a process of healing within the client. So that was kind of a radical relearning for me. It's taken me perhaps 20 years to make that shift.
I love what you just shared. You're a servant to the client's story.
Yeah.
That's beautiful.
Yeah.
That is really beautiful. And I think I'll be using that in future trainings. We've learned so much from the Rudens. Obviously, for those who aren't familiar with what havening is, this is the modality, the neuroscience-based approach that both Dr. Youngson, Robin, and myself use in our practice, as you know. It's a beautiful healing approach that puts the power of active emotional well-being in your hands. Something you can use without even our help. You can do this every day to self-regulate and self-soothe for self-care. Obviously, for deeper rooted upsets and traumas, always good to work with a certified practitioner so you have support. Never good to do trauma work on your own. But this is a beautiful approach. And I'm going to put some information in the notes about havening and also how to get in touch with Robin, and also to grab the book, The Science of Miracles. And I'm also going to put a link in there for Time to Care, because they're two very different
Yeah,
books, but
thank
I
you.
think they're both really beautiful books to have in your library as we're building the Holistically Speaking podcast library. People will never run out of reading by listening to this podcast, that's for sure, because I always have the best on here. And Dr. Ron and Dr. Steve Ruden, who are brothers, co-developed the havening technique, and it is by far the go-to for me, and I know for you. For you, the one thing I would love to talk about a little bit is, you've worked with the World Health Organization,
Hmm.
you've worked with the government in New Zealand where you're located, and how has that been for you as far as the reception
Yeah.
and going forward, being in this area of health now, care now?
I mean, that's a major theme in the book because,
Hmm.
I mean, I first started trying to change healthcare as a junior doctor, as an intern. I wrote my first book, which was a handbook for surgical patients, explaining to them what happens when you go in a hospital and who are all the staff and what are these tests and will I die if that little bubble in the IV line gets into my vein? And, so many questions like that because I discovered as a junior doctor working 100 hours a week in the UK, that the patients were so afraid and so uneducated and didn't know, no one really talked to them as human beings. And I felt so motivated to try to give them some knowledge and some power. But I was far ahead of my time in those days. This is about 1990. The bookshops did not have a shelf for kind of self-help medical books. They didn't exist as a genre. So my book kind of got filed with the nursing textbooks, and so no one knew where to put it. And I've just been passionate my whole life. I was an engineer first and I did an engineering degree and then worked for 3 years. And that gives us a language to understand structures and systems and processes and mechanisms and dynamics. And when I came into the hospital system, I found a completely disordered system that was incredibly inefficient and that hurt a lot of people. And I saw so many opportunities to re-engineer patient care pathways and to provide better quality, safer care that was just better for everyone, better for the workers in the healthcare system as well as the patients, and which would save money. And that's been my passion my whole life. I've been a pioneer in patient safety. I've been medical director of a hospital and worked with a very inspirational leadership. And we actually completely transformed the culture of a hospital. We had the opportunity to design and build and commission and open an entirely new 200-bed hospital in a disadvantaged community where there had been no hospital before. And there was kind of like tsunami of demand arrived in the emergency department the first day we opened the doors. And we did so much work on compassion and caring and eliminating bullying, which is very widespread in healthcare, and creating a friendly and compassionate environment. And we're pioneers in patient safety, like after a terrible adverse event when a patient was horribly injured, and it was #1 story in the newspaper nationally, we employed apology and open disclosure and a radically different way of addressing, bad events and building trust and rapport. And so I pursued that work relentlessly for decade after decade after decade. And then, I was just trying so hard to bring more humanity and compassion into healthcare and finding it resisted. And I couldn't get it on the agenda of the National Committee. I couldn't get it on the agenda of the WHO. So eventually, after the experiences of our daughter, we thought, well, maybe there's another approach. So I quit all my committees and all my roles and my job, and so did Meredith. And we founded an international movement for compassionate healthcare. And I wrote the book, Time to Care, How to Love Your Patients and Your Job, and traveled around the world. And that got translated into Dutch and German and Hungarian and sparked movements in those countries. And we helped maybe tens of thousands of individual health professionals reconnect to the heart of the practice and find more joy and satisfaction and care for patients in a better way. But the system itself just stubbornly refused to change. We had compelling evidence that compassionate care gets much better outcomes, clinical outcomes for patients, that it gives joy and satisfaction to the work of, doctors and nurses and therapists and midwives, that it dramatically reduces patient demand. There's even research in the USA looking at how patient-centered is the care in primary care. And if you're above the 50th centile, so the 50% of people who get more patient-centered care, their total cost of healthcare is 30% less than the patients who don't get patient-centered care and primary care. That's research from the USA. I mean, really stunning research showing that we could save a vast amount of money. So it's a win-win-win for the patients, for the health professionals, for the funders, the providers, the insurance companies. And it should spread like wildfire, and the system would not change. And I began to dwell down into, I always ask the question, why? Let's not blame people. Let's not just say they're greedy or corrupted or whatever. Let's really dig down and try to understand. And eventually, through coming to this healing work, the havening work, and understanding the extraordinary capacity of a conscious human being to heal, realize that the fundamental problem is the nature of our science, this materialistic, scientific materialism, the science that reduces a human body to a machine, the science that assumes that mental illness is the result of a chemical imbalance, therefore must be treated with a drug. This is the fundamental difficulty in our society, and it applies right across every different field, whether it's health or education or housing or food production. It's a set of societal myths and beliefs about the nature of the world as an unconscious machine. And yet, if we realize that human beings and nature is conscious and alive, the possibilities for change are just, endless. And, I just kind of gradually, bit by bit, through a variety of extraordinary encounters with healers and others, discovered that the scientific world as had been described to me and that I was immersed in was in no way a description of the real world. And there's far more sitting beyond that. That's what eventually led me out of medical practice and led me to understand that, really good people trying their best to make healthcare better are just stuck because they're stuck in these mental models of how we should try to fix things, as if things are a machine, as if a hospital is a complex machine. So you need a command and control management structure to address their feelings and their beliefs and their experiences. We utterly transform clinical care.
And everything you're saying reminds me of just needing to be heard and understood. And, I had an example of a story that happened with my mom, actually, when she was seeking help from a new doctor, and she was really needing care, and she wasn't getting care. And this was, I don't know, maybe 5 years ago or so. And we finally got an appointment in with the doctor who she had never met before. And when the doctor actually walked in the room, she was holding a clipboard. She was frantic, and she's like, she was very upset because she's like, this is just adding another patient to my plate. And she kind of directed her upset towards us. But my mom and I looked at each other because we both come from that compassionate place. And we were like, we kind of winked at each other because we could tell, even though my mom was in pain, this woman was just overworked. And you talk about that in the book, the physiological effects and the extreme overwhelm and the fatigue. And actually, I talk about that a lot with the secondary traumatic stress and vicarious trauma and compassion fatigue, especially coming from the field of journalism.
Sure.
We call it the forgotten first responders. The way that we approached her was just like, I understand this. You must be so overworked with so many people. And like just saying that to that doctor diffused her. And suddenly she sat down with us, and what was supposed to be 15 minutes, right? Because they usually only give you about 15, turned into 45, because I think she just needed to know that she was appreciated and heard and needed a break. We need more of that. We definitely need more of that.
And I think as trauma therapists, when we look at a doctor behaving like that, we're seeing a very traumatized individual. And you talk about vicarious traumatization, and that's true, but we need to take a step back and realize that the process of medical training itself is profoundly traumatizing, brutalizing, dehumanizing. As a what you would call a resident, as an anesthesiology resident in a large city hospital, on a 15-hour shift one Saturday, I had 3 young patients in a row that all died despite my best efforts. There was no suggestion that I should stop work or take time off or go for counseling or take stress leave or whatever. I was just expected to continue. I reported all the deaths to the coroner and wrote the records and, felt really traumatized and shocked and grief-stricken. And I've anesthetized 5 more patients that day, all emergency cases. And I remember I had a cup of tea and trying to calm myself, and I went to the patient and I was doing informed consent. And I remember the thought in my head, I wonder if it should be part of informed consent. Shall I tell this patient, maybe you don't want me as your anesthesiologist because my last 3 patients all died? And I thought, no, I'd better keep quiet about that.
Yeah.
And then
That-
the Sunday I did another 15-hour shift and then turned up for work at 8 o'clock on Monday. And there was no debrief, no counseling, no support. I mean, this is how we cause PTSD. Most doctors I know have PTSD. They have burnout, and the symptoms of that are emotional exhaustion and depersonalization and cynicism and a lack of personal agency, like they feel their work doesn't do any good anymore and the patients, are just demanding too much. And it's, that's what you're describing as the doctor that first presented, and what you did beautifully was empathize with her and, open up her heart a little bit, which is a lovely story.
I think about that a lot because, we get so frustrated in the healthcare system. Just getting on the phone and trying to get an appointment sometimes is a struggle. And just knowing that, and I have a lot of friends, obviously, who are doctors as well, that still work in the system, and it is just daunting and wearing. And it's not just about the patient, it's also about the person who's providing the care. And I want that person to feel like they're cared for. But it also comes back to, what are you doing to care for yourself? So let's circle back for a second, because I'm curious what you think. If, and I don't mean this to be a pitch, but quite frankly, I can see it working well, but can you see an entire medical system that uses the Havening techniques in their approach? Like, how different doctors and practitioners would be?
It would just be utterly transformative. I was doing research into mothers with severe PTSD as a result of childbirth trauma, which about a quarter or a third of all women in the Western world experience, sadly, in our medicalized childbirth system. She had severe PTSD 20 years after the birth of her son, who had also been rendered disabled, and she still looked after him. And, her score for PTSD symptoms was kind of off the chart. And in one session at Havening, her score came down really nearly to zero. It was just typical of the responses I saw. And so she was cured of her PTSD in that one session. She went on to have 2 more Havening sessions, not with me, but with actually one of my students I was supervising, for 2 other major life events. Now, this person was in her 50s. She was overweight. She had type 2 diabetes. Her diabetes was completely out of control. Her blood glucose was nearly double what it should be. I mean, really completely out of the safe range. She was on a lot of medication. She was on a restricted diet. She was, looked after carefully by diabetic clinic doctors, specialists in the field, but they couldn't get her blood glucose under control. But after the 3 Havening sessions, her blood glucose fell by 40%. And the long-term measure of her blood glucose is a thing called HbA1c, which measures how blood kind of affects the hemoglobin, how glucose affects the hemoglobin in our blood over a long period of time. And that fell from 94 to 60. And she had no change in medication, no change in diet. And the explanation is very simple, that simply as a result of healing the 3 major traumas in her life, her cortisol levels fell. So cortisol is a stress hormone, and an acute stress hormone. And the first job of cortisol is to tell the liver, make lots of glucose so you got lots of energy for the fight and flight reaction, right? Mm-hmm. And she just had chronically extremely high levels of cortisol that was pushing her blood glucose way up. Now, obesity and diabetes is the biggest threat to, our health status in the whole world. We have an epidemic of obesity and diabetes causes kidney failure and arterial disease and blindness and amputations and heart attacks. And I mean, it's just the biggest. And if we actually just help people heal their trauma, so many diabetics would actually come back in control and dramatically reduce, their complications. I mean, that's just one illustration. Or patients with severe chronic pain. I had a client with severe fibromyalgia for 40 years. This is an extremely painful condition of muscle inflammation and pain. It was very disabling. Even to lie in bed at night, it was acutely painful for her. And she's been on lots of medical treatments like steroids. And we did 4 sessions of Havening over a week. And at the end of the last session, she danced on the mat behind me, a jig of delight, because all of her muscle pains had gone and her fibromyalgia was cured. These are conditions for which we have no effective medical treatments. And Dr. Gabor Mate, who's a world authority on trauma, in his new book, The Myth of Normal, says that if you have early life trauma, it changes all your gene expression, it creates inescapable physiological stress, it turns on all your inflammatory mediators, all the chemicals that cause inflammation. It rewires the brain. It changes the whole hormonal environment. And that means that you're 4 times more likely to develop endometriosis, or 3 times more likely to get autoimmune disease or cancer or heart disease, whatever. These are much more important things than smoking cigarettes or high cholesterol or all the things we try to attend to. So if we had a healthcare system where we actually treated patients as conscious human beings and worked with their stories and their beliefs and their trauma and their feelings, we would utterly transform the whole practice of medicine. But it might take a while.
But we have a while.
Yeah.
Right. And you mentioned earlier that you have another birthday coming up, and you've been in the medical field for 30 years. You started as an engineer and you moved into medicine. And I want to ask you, what would be next for you? Like, where do you want to go now that you have this book out and you've been doing havening?
I kind of like to start to retire and take it a bit easier, but I'm mindful of the pile of great stories. I mean, when I sent my original manuscript to 5 editors to try and find an editor with a sample chapter, 3 of them said, you should be writing medical thrillers. So maybe that's the next thing, just as a hobby career, in retirement, is writing medical thrillers.
Whatever brings you joy. I mean, you're and doing this for less than 5 years, just in 2020, about 5 years now, even if it's just been the last 5 years. And
it's been the most gratifying work I've ever done as a doctor. I mean, I really just see miracles in front of me every day. It just blows people's minds. It's so different from their experience of spending 3 years telling their terrible stories to a counselor, or, just and the astonishment that you see on clients' faces.
Look, there are so many wonderful psychotherapists out there, many of which are havening trainers and
Sure.
practitioners, my mentors. But sometimes telling the story over and over can be a lot. That could be traumatizing
Sure.
and triggering as well. So having different tools to support yourself. And like you said, there is humor in the healing,
Yeah.
when we can look back on something later and be able to laugh a little bit. That's part of just the joy, and that is our human right, the ability to just be joyful and present and happy.
But even in the process, to have someone in floods of tears and deep distress with just briefly touching on the memory of a just dreadfully traumatizing event, and within 2 minutes to see them smiling and laughing and the energy shifting, because this is a process that's catalyzing a chemical reaction in the brain that the brain is designed to do, that occurs in just a few minutes. We evolved our safety systems to try and keep us safe from many hazards in the world. The amygdala, it's like our emotional safety system. And it's evolved to encode or store a trauma in just a few minutes to affect us for the rest of our life. But evolution is smart. So at the same time, it evolved a balancing chemical reaction that does the exact opposite. And that's the genius of the Dr. Rudens, is to uncover this extraordinary mechanism within the brain and figure out ways to catalyze it, to activate it, and to connect that to, human touch and healing and connection, and to, write a very, very detailed scientific model for exactly how this is working. And as an anesthesiologist, I'm a very skilled observer of human physiology, and I see major physiological changes occurring within minutes as all the stress reactions disappear. And everything that the scientific theory predicts, I see come out true. And it gives us such precise diagnostics tools. I mean, it's very precise work. There's an art to it and there's a science to it, but I'm astounded that such a powerful and simple theory plays out, with such veracity in so many clients. And I've never seen a client that's behaved in a way that said, no, this is not right. There's something wrong with the theory. It's a better predictor of what happens than a lot of medical scientific theories.
Yeah, love that. Thank you so much for sharing that. I want to mention again, the book is The Science of Miracles. Hold it up. It's a little fuzzy there. There we go. Science of Miracles. We're going to put everything in the notes of the podcast so that you can grab Robin's book, or even Time to Heal, which was his first book, even some links on how to get in touch with him and find him, because it's easy to find you, which I love.
Thank you.
You put out some really beautiful content. But also, if you're interested in learning more about havening, we'll have some information about that. Or if you're in the medical field, or if you are a practitioner, a doctor, a nurse, first responder, my goodness, you don't even need to be in the field to put havening into your life. As both of us are trainers, we have regular training so that you can learn about the fundamentals, learn about the science, the history of havening, and even go on and get certification and mentorship. So that's a possibility as well. All of that will be there. But what I want to do with you first, not first, but the next step I'd love to hold space for you, Robin, as I would love to play a little game with you. I do this on my podcast. Every episode, my guests get to play a little word association. And what I have been doing is writing down some words. And what I'd love for you to do is just come back with the first word that comes to mind.
All right. Sounds like fun. Makes me slightly nervous.
I get that a lot. Okay, here we go. Compassionate.
Healing.
Stress.
Healing.
Safety.
I kind of feel like the idea of kind of wrapping this nest of safety around people. Yeah, nest.
Like
nesting.
That. Nesting, that's a good word. I like that. Connection.
Humanity or humanness. Yeah.
Bullying.
Trauma.
That was my next word. Trauma.
But, there's no word coming up. I mean, it's such a massive...
No one word?
Curiosity. There you go.
Okay, I like that. You've reframed that. Humor?
Yeah, laughter.
Havening.
Blessing.
Oh, I like that. And two more words. Care.
Touch.
This is good, Robin. And final word, miracles.
Miracles, well, Einstein said we can either live our lives as if there are no miracles, or we can live our lives as if everything's a miracle. Conscious living beings are miraculous, whether it's human beings or nature itself. Now, if we want to solve the climate crisis, we just have to allow nature to heal itself. It can do so rapidly. We have to stop trying to fix it. We have to stop trying to fix human beings, because they heal themselves so much better.
And they're not broken.
No. Well, perfectly broken.
Perfectly and perfectly broken.
That was the title of my TEDx talk.
Is it?
Perfectly broken and ready to heal.
Love that.
Yeah.
Love that. We're going to share that as well. That's great. This was such a joy. I am so happy that we were able to cross continents and waters and share this time together. You're a delight. You're a gift.
Thank you.
I'm just so elated to have you here. We're going to share everything in the podcast notes. But please, I want to offer you a moment and invite you to share with those who are tuning in to Holistically Speaking. What would you like for them to walk away with from this episode?
Yeah, I would just love people to understand that they have just extraordinary healing power within themselves. Yeah, to seek out whatever modality is, seek out a practitioner who's going to see you and connect with you and believe in you and help you facilitate your own healing, because that will just unfold miraculous changes for you.
Yeah, just being a human being over a human doing.
Yeah.
Being the most authentic version of ourselves.
Someone said to me, tongue-in-cheek, well, Robin, you spent your whole life putting people to sleep and now you're waking them up.
That is brilliant. That needs to be on your business card.
Right.
That's a very clever way of putting it. And how did that resonate with you when you heard it?
I laughed, yeah.
That's great. Robin, thank you so much. It was a pleasure having you.
It's a pleasure. Thank you.
All right, my friend, if you want to learn more about Dr. Robin Youngson, or even pick up a copy of his latest book, The Science of Miracles, or perhaps you want to learn more about havening techniques, whether it's putting it into your own personal life or being part of your profession, your practice, all of the information you need is in the notes of this podcast episode, including all of the books that we've had on Holistically Speaking in the Holistically Speaking podcast library. And if this conversation touched, moved, and inspired you in any way, if you know one person where this conversation could make a difference, consider paying it forward, pass it along. You never know who it could touch. Holistically Speaking is edited by Two Market Media with music by my dear friend Litbone Redding, and of course supported by you. So thank you for taking time to spend the time with me here and tune in week after week. It doesn't go unnoticed. And I want to leave you with one thing. I want you to remember that everything you need, you have within yourself to be able to heal, to find the support you need, the compassionate care that is out there in this world, to hug it out with yourself, and to be kind to your mind. I'm here to support you. I love you. I believe in you. And I'm sending hugs your way. Be well.
I know the girl with mountains